talk to you about some common myths around bariatric surgery. I hear them all the time. I have patients question me about those, and I think it's time to talk about it. So let's do it. Number one myth that I think people who have not been around someone who has had bariatric surgery, something that they often say is bariatric surgery is the easy way out. It is not. Bariatric surgery requires a lifelong commitment. Bariatric surgery helps with weight loss. It gives you a tool to help lose weight, but it is not the easy way out. Think about all that we go through: the pre op diet, the appointments, a major surgery, a recovery, changing the way you eat for the rest of your life, and the potential risks that go along. It is not the easy way out. So let's get rid of that myth. Let's bust that one first. Number two, you will never eat normal food again after bariatric surgery. This is so not true. This myth is why I make my What I Eat in a Day videos. Not to show people what they should eat, but to show people what you can eat after bariatric surgery. Yes, it is a process. You have to go through the post op stages in your diet. And for the first year or so, it's a little different. But you can eat normal foods again. Does that mean that you should go back and eat the way you did before surgery? Absolutely not. We got the way we were needing bariatric surgery because of, at least in part, what we ate. So we do need to make changes. But you will be able to enjoy food again. You will be able to participate socially in meals with friends and family. What you eat is not as much of a change as how much you eat, at least in my situation and with most patients that I've seen. So that myth is busted. Number three, your stomach is going to stretch back out to what it was before. That is such a myth. I like to explain to patients in a gastric bypass, a large part of your stomach is exactly that, bypassed. In a surgical sleeve, a large part of your stomach is removed. There's no stretching back. However, you do build tolerance. Part of the natural healing process is your stomach beginning to be more flexible. Ace wants to be part of this. Your stomach will become more flexible. Think about after you have surgery and your stomach is healing, there has been a huge insult to your stomach, a surgical injury. It is very firm and very rigid. It's almost like the consistency of one of those old-fashioned hot water bottles that we used to put on our back when we had a backache. After time, when your stomach heals, it becomes less rigid and it becomes more of the consistency of a balloon, stretching to fit what you eat. However, it's never going to stretch back to that size it was before. But what can happen is the discomfort that you feel when you overeat. If you continually overeat, you're going to be less receptive to those cues. It's just like when you do anything painful or anything uncomfortable, your body is going to get used to it and it's not going to give you those same feelings that it once did. That's why it's very important to not just count on the size of your stomach, but count on the change that you need to make. So that's a big busted myth. Next one. Everyone loses all their excess weight when you have bariatric surgery. I think we all know that is BS. Not everyone is going to lose all their weight. You will lose, on average, there's a calculation that your surgeon can do to tell you what your anticipated weight loss is going to be. With the sleeve, it may be 60 to 70% of your excess weight. With the bypass, it may be 70% of your excess weight that you're expected to lose. It's not going to be all of it. So I think anybody who has lost weight through bariatric surgery knows you're not going to lose everything you want to lose. Also, your body readapts to carrying around all that excess weight for years. Your organs get larger. Your bones become bigger to accommodate that bulk. So you're not going to lose that. So that myth is busted. You will another myth, and I can speak personally to this one. After bariatric surgery, you will never be hungry again. Your hunger does diminish those first few months. It may even go away. I Mine probably went away for about 3 months. It started gradually coming back, and now I feel hungry, and that's okay. That is my body signaling to me you need to eat. I have to pay attention to, is this real hunger or is this head hunger? But I feel hunger for sure. The hormone that can promote hunger, called ghrelin, when you have bariatric surgery, is greatly reduced, but your body adapts. The body is an amazing thing. It adapts to that lowered ghrelin. Eventually, that ghrelin will come back. So, that is a big myth. Another myth, as long as you eat well, as long as you eat healthy, you don't need vitamins. I think I've done enough videos on this. This requires minimal discussion. Your absorption changes after bariatric surgery. It does not matter if you are eating a textbook Mediterranean diet, you're still going to need to take your vitamins. Big myth busted there. Another thing, bariatric surgery cures obesity. Bariatric surgery can put obesity in remission. Obesity is a chronic illness. And just like any chronic illness, it is going to be in remission with treatment. Hopefully, that's the outcome that we want. That's our goal. But it's not going to cure it. There is always the potential you may need additional treatment. You may need to adapt treatment. It's not a cure, it's a treatment. So remember that. That's a myth busted. This goes along with the next myth. If you regain after bariatric surgery, it is a failure. It is not, folks. Some regain is normal. And if you start regaining, then that is a signal that you may need to change your treatment. You may need to add an additional treatment. That can be in the form of a dietary change. That can be in the form of tweaking your macros. That can be an additional medication. It could even be a revision, but it is not a failure. And that is why I encourage my patients, stay in touch with your bariatric team. If you see the scales start creeping up, now is the time to do it, not 20 pounds down the road. Treatment is much more effective if it's initiated early. Another big myth. Only extremely obese people qualify for bariatric surgery. This has really changed the last few years. The guidelines from the American Metabolic and Bariatric Surgery Association have changed. Now, bariatric surgery is even recommended at a BMI of 30 with certain comorbidities. It is not my 600-pound life people that only, those are the only people that need bariatric surgery. I used to believe this, and I'm so glad that I educated myself. Bariatric surgery is, I would say, probably 30% of adults would qualify for bariatric surgery. Is it right for them? No, but they would probably qualify just on paper. So get rid of that myth. Let's bust it. The last myth. the biggest myth that I want to sing from the mountaintops. This is not true. Bariatric surgery is your last resort. That is total myth. I have so many patients tell me, I want to wait until I can't do anything else to have that. That is like the last thing. I'm going to try GLP-1s. I'm going to try Weight Watchers. I'm going to try fasting. I'm going to try all these other things before I resort to that. I used to believe that too. It was not so much a belief as I didn't want to accept that bariatric surgery was right for me. It is not the last resort. My only regret in this surgery is that I wish I had done it 20 years before. And I wish more people would realize that. That is a huge myth, folks. Let's get the word out. Bariatric surgery is not the last resort to treat obesity. Guys, I would love to hear what are some myths that you have heard that you believe are absolutely not true. Tell me where you're at in the process. I would love to hear from you. I would love to hear any struggles you're having, any questions you have, any video ideas. I'm coming up on my 4-year surge anniversary, and I'm going to do a Q&A video, maybe just some easy questions that aren't enough for a full video, but just anything. Ask me anything, and we will address it in a video. I would love to hear from you guys, so leave your comments below, and I will see you next Wednesday. Bye.